Jodie, Carol and Laura from who are going to run through a case study based on a Tasmanian experience, and they're from One Care Rubicon Grove. So I'd ask Jodie, I should say, Carol and Lauren to come up.
Hi everyone, thanks for having us. As they said, we're from Rubicon Grove. We're an aged care facility in Shearwater. We're only 4 years old and we have 63 staff and 60 residents. We're run by the One Care organisation. 12 months ago I started a new position for the organisation, and part of my role was Workplace Health and Safety Coordinator. When I was doing some research on the WorkCover site, I discovered you could get the free visit from the Wellbeing Advisors. When I saw free, I thought, wow, let's do this. We don't get much for free, and we know there's no money in aged care. So with the support of my manager, we booked an appointment with Sam Forrest. Sam went through the survey with us and the implementation process, advising us on how to create our successful Be Well program. At the same time, Corporate Office was organising a Be Well for Work project for One Care. All our interested staff were invited to participate in a 2-day course which looked at ways that staff could care for themselves in a holistic manner. This was to our advantage at the time because Corporate Office had already recognised the benefits a Be Well program would have for us. I knew as a facility we were really good at looking after our residents in a holistic manner and catering for their needs, but our staff and our management, we didn't apply the same principles to ourselves. And considering we spent so much time at work, it made sense to start fostering these good habits in the workplace. It was important for us to be able to show our staff that they were important and they were valued as an individual as well as an employee. So how did we do it? We set up the program. To set up the program, we recognised that we had to implement over a 5-year period. We wanted to take small steps to make sure we didn't fail by setting unrealistic expectations. We decided our first steps would be to sell it to the staff. So we chose to create a health hub as a way of doing this. The Health Hub is an area purely for health resources, such as brochures, recipes and computer access to healthy links. We place all our photos and information of past and coming events here. This is somewhere the residents, staff, family and guests can use. It promotes a lot of conversation among people and it inspires many to participate. I thought this would be an easy starting point and that I could do it with no money. But I realised I could not do it on my own, so I chose 2 people to help. We all have these people in the workplace, people that are really ready for a challenge and to participate and help out. I knew Carol and Laura would help make a difference in this. The 3 of us then formed the working group and planned a launch for the Health Hub. This really served 2 purposes for us. We wanted to sell it to the staff and we wanted to create some community contacts. So we invited all our health professionals along to provide free health services on the day, like podiatry foot screens, we had massage, physio, we had counsellors, alcohol and drug education, just to name a few. We provided a healthy afternoon tea to show that healthy food can be delicious, and that was all through donations as well. And lastly, we got enough donations for all staff to receive a gift bag, because we knew people would come if there was going to be freebies involved. The bags include things like water bottles, pedometers, hand creams, pens, pads, fresh fruit. There was a flicker of interest and we were on our way. To help us build the program, we put out a survey. We needed to know what staff were finding were their health concerns. We knew staff were reluctant to discuss these concerns because of the resident comes first culture we already had. It was a new thought process to stop and consider our own needs. This was difficult and it did take time. From our surveys, we created the 12-month plan, which consists of daily, weekly, monthly activities, which Laura will cover in more detail in a moment. We also won a $1,000 grant from WorkCover, which allowed us to purchase our sports equipment and cooking appliances, which got us started. So we realised to have our safe workplace, it did have to be a well workplace. So we focused on why staff were actually absent or sick. Also the effects of presenteeism had on us. We considered the following causes were our main issues. Staff were generally unwell, stressed, bored, tired, unhappy, or had family issues. We set a number of goals. We wanted to decrease our sickness and the effects of presenteeism. We wanted to decrease our injuries. We wanted to minimise staff turnover. We wanted to reduce stress, create a supportive team, enhance fitness and nutritional knowledge, and have healthy eating options available to staff at all times, as we run a 24-hour facility. We wanted to empower staff and give them permission, so to speak, to know it's okay to stop and make time to look after themselves. We wanted to make our plan available not only for our staff but their families as well. We all know we cannot function at work safely if we're worried and preoccupied about a sick family member or the burden by stress. To do this, we had to listen to what staff felt were real concerns for them. And we not only wanted to use our person-centred care approach on our residents, but on our staff and their families. As we really are people looking after people. We also had to create an environment to foster this. We have to give them permission to stop and look after them. Our challenges have been, we had to sell it to the staff. At first we got many eye rolls, and as if we've got time for that. This is why I think it's so important that you have a committee to keep encouraging each other when you just thought it was too hard to get people to understand the importance of self-care. We had varying levels of fitness. We've got many different ages in our workplace, and we had to ensure that our activities were for all levels of ability and interest. We had different health concerns and priorities, staff acceptance and participation, and lack of resources. We started this on a volunteer's hours. As the organisation has seen the benefits, we now have 6 paid working hours, and we share that a fortnight, and we share them amongst staff to cook our healthy lunches or set up the month's activities. It's really taken 6 months to see a big change in our culture, and a highlight for me was when 2 of our least supportive staff have asked how they can become involved. As the time went on, staff have become more readily sharing of the concerns they have with us and actively seeking us out to implement new activities and programs. We've been fundraising to add additional money to our program just to be spent on things purely to benefit the staff. Promotion is also a big focus for us. We've had many articles in the Advocate, the La Trobe News, the Australian Nursing Federation Journal and the National Physiotherapy Journal in motion. We spoke at an aged care services conference and we're here today. We celebrate all our wins and achievements, no matter how big or small. And I believe we've managed to change our culture by staff seeing that we're just not a feel-good fad that was going to go away. We've proven we're committed, and the organisation is investing in resources, providing education and putting hours into the program. I believe staff now feel that we're actually listening to their concerns and trying to do something to really help them. WorkCover has been such a supportive encouragement, and I do suggest you use them. Now it's over to Laura to tell you about the Fitbit.
Thank you, Jodie. Due to my passion towards health and fitness, I was very excited to be a part of the Wellbeing Committee. Each week I focus on one area of our plan, the plan covering physical, nutritional and mental wellbeing. Although we've just had a quick break standing up, before I continue, I'd like everyone to please stand from their seats. Now, if everyone could just have a quick stretch, any kind of stretch. Thank you. I asked you all to do this because through research we have found out that sitting has become the new smoking. More people are dying due to sitting for too long of periods. Due to this research, we have set up a program in our office which involves any staff sitting for half an hour have to get up and do some form of physical activity, even if it's just the basic stretch. Our Wellbeing Committee have many other physical programs and challenges set up and running at Rubicon. One that we believe is important to note is our Walk Around Australia program, which involves both residents and staff. Each morning at 11 a.m, residents meet with staff at the front entrance and walk around the facility. This distance is half a kilometre and we've been all around Tasmania and well on our way to Western Australia now. Also including residents with our physical side of things, each Tuesday a bus and a carload of staff and residents enjoy a walk along Shearwater foreshore as part of the Heart Foundation Get Moving program. On return they always enjoy time on the community gym equipment. Furthermore, the Be Well Committee organised a community Olympics involving Latrobe High School teachers and students. This ran over a month with many challenges set up around the facility. The Olympics was a great start to getting staff really involved amongst the physical challenges, and since this we've had many monthly activities and challenges running. Squat challenge, skipping challenge, core strength classes, hopscotch challenge, gym step exercises, yoga, pedometer challenge, and the list goes on. It has been great to see more staff get involved each month, and with the prizes being given out, I think it has made even more staff see it's got more than its health benefits. So as explained, there has been quite some activity going on in the workplace, but it hasn't stopped there. Many staff have participated in community fun runs and walks. As everyone would already know, being healthy doesn't only involve exercise, more so it's about what you eat. So to promote healthy eating and show to staff that it can still be yum, we do fortnightly healthy cooking for $5 a meal. Recipes are provided to staff, and at the end of the year we're going to put them all together as a cookbook for staff to purchase. Staff are always notified through email and posters around the workplace and when the cooking will be taking place, so then if they choose to come along and watch, they can. As we're unable to cook every day, we're lucky enough to have free fresh fruit provided to all staff, and there's healthy snacks if they wish to purchase them. Another lucky moment to mention is Rubicon. We're lucky enough to have the executive chef from Launceston Country Club Casino come to our facility and do wonderful healthy cooking. This was for both staff and resident, and we felt very honoured that he came along to do this in his own time. Overall, our committee wants to focus on each individual's wellbeing at Rubicon Grove, hence our name. Every month, along with other information that has been provided, there is also a topic that will be focused. So there is always something for staff to keep them interested. To inform you all of some we've had, there's been Stress Down Day, Joke Week, Trivia Night, the Nurses' Breakfast, free health checks provided by our nursing staff, and the list goes on. I could talk for hours on all that the Be Well Committee has achieved at Rubicon Grove with all our staff, because it truly has made a difference and impact on many people. But I won't. Instead, I'll pass on to Carol, who will talk with you all about the changes it's made for her with her life. Thank you.
Thank you, Jodie and Laura. My role at Rubicon Grove is the ACFI coordinator, which before Be Well entailed sitting down most of the day on the computer. As most of you know, ACFI's paperwork. When Jodie approached me to be on the Be Well committee, I accepted the challenge because I'm one of those team members who likes to take on extra tasks. I did not realise then how fulfilling or life-changing this could be for my career or my personal life. I used to be that person sitting on the couch in my PJs doing very little. Actually, I'd get up, shower, dress and buzz around and do my housework, but then I'd sit on the couch. I've since found out that on our walks, Marie, our facility manager, who also likes sitting on the couch, that she'd be reading a book. I didn't like to exercise or engage in social activities at work. This in itself can be very isolating when working in a team environment. Since committing actively helping, I thought I must talk the talk and walk the walk, because who wants to listen if I wasn't prepared to get off the couch myself? So I started joining fun walks. I felt such an achievement from completing the Burnie 10. It encouraged me to go out and get moving, to increase my fitness and to register for more events and beat our times. And on that note, we beat our time on the Burnie 10 on Sunday. I started encouraging other staff and friends to join as well, as they too can feel great. I also encourage them to join in challenges that we have on our planner each month, as well as our Walk Around Australia group with our residents. The walk is a subtle way of reminding other staff to get off their chairs to join in. And along with our facility dog Marco, everyone enjoys the walk and the fresh air. As well, Marco and I go for a walk every morning when I'm at work. Marco and I were having a little chat one day about what more can we do to get people moving and to break up the day. So we decided to ask other people to join us on an afternoon walk. This is how it started. Marie and I started a late afternoon evening walk on a Thursday. Then we started walking to work of a morning, and boy was that a walk. The walk home was a big challenge. It included a massive hill. We had many stops to look at the view. We don't pause 3/4 of the way. It's full steam ahead now. I feel so much better in myself since exercising, and this is evident. As I sleep better, because I've cut out that bad foods, I have more energy, as I'm not as tired. I am stronger. My endurance has gone up a level or two, and I feel as though I could conquer the world, and that is thanks to Be Well. I then looked at my diet, as I don't like to cook, healthy for myself, and I'm one of those people who don't enjoy cooking. So if it fits in the toaster, I cooked it. My husband and I alternated toast to Pop-Tarts every night, and this was easy but not healthy for us. So with the resources from our healthy recipes plus healthy options available to snack on, and being able to purchase my healthy main meal from work, my diet improved. And I now help with our healthy meals for the staff each month, not only in my cooking, but I'm learning to experiment. Participation in my work, with my work colleagues and activities in and out of work has boosted my morale. It has enabled me to build friendships, to have a more positive outlook, and this in turn has reduced my stress levels in work, environment and at home. The promotion and normalisation and looking after my own mental wellbeing has made it easier to recognise when to seek help from our facility counsellor and advise others. It has a huge benefit in my relationship and accepting of others instead of isolating myself. As a group, we recognise when someone is looking stressed. We now feel comfortable to say to one another, "Come on, let's go for a walk," or sit in the massage chair for 10 minutes and not feel guilty about it. It is amazing how good you can feel and how much better you can focus and work after taking that break. I actually get to spend more quality, unrushed time with our residents by being encouraged to walk and exercise alongside them. I feel so much more valued. I enjoy coming to work with an organisation that cares about me as an individual and my wellbeing at work and at home. So thank you, OneCare, Rubicon Grove, and especially our manager Marie, for your support in encouraging us to explore these options, which has resulted in a great program. It has changed my life. And Marie, you can thank me later, as I did get you off the couch too. I can honestly say, since being part of our Be Well committee, it has enabled me to improve my life and wellbeing, mentally, physically and socially, and as well as my diet. And no more Pop-Tarts. Thanks for listening, everyone. And does anyone have any questions for Jodie, Laura or myself? Thank you.
We do have certainly have 5 minutes for a few questions. I've heard that story twice now. It's a fantastic story. I'll tell you a quick story about Carol and her dedication as a health and wellbeing champion. I rang to contact Jodie just to firm up today's details last week, and Jodie had rudely taken off to Queensland, I think, for a holiday, so balancing her wellbeing. And just to check up about the Rubicon team and coming to our champions training in Burnie, because I didn't see anyone on the registration list. And so Marie said, "Oh look, I'll get Carol to come along for you." And so Carol turned up and on her day off, mind you. And then yesterday, Carol's turned up to our Launceston session. So they were registered for the Launceston session. but not for the Burnie, but I hadn't actually looked that far ahead. So talk about dedication day, often she's done a double up of health and wellbeing champions training. But you can see that enthusiasm's certainly starting to rub off through their organisation. So a fantastic story, well done. Any questions?
What do you see now the next challenges in trying to, you've obviously done a brilliant amount of work to get the program and the engagement where you are now, but what do you see the next stage, or the next bit, or the next challenge you've got with that program?
Continuous. We just want to continue and get more of our staff involved.
We've got pockets probably that aren't involved, and that's our challenge, I think, to work out what areas they need, because we're obviously not supplying them with what they want in the program. So, like catering aren't so involved, so we want to know what their concerns are and how we can help them.
Hang on, Kate.
Do you feel like that improved, I guess, staff morale that you guys now have has also maybe had an impact on the residents at all?
Definitely. That's a big thing for us, really. If you've got happy staff, their whole morale goes forward into the residents' room, the residents' life, the families, their care.
Plus they're interested.
Yeah.
They're definitely interested in what's happening.
And this is Marie, the manager of Rubicon Grove at Port Sorell, doing a fantastic job.
Please stand up.
Yeah, I guess when you mentioned that when you were going for walks with the dog and that some of the residents were coming along, I kind of realised that that's a pretty amazing outcome in itself, that you're getting people who are older and probably relying on you guys quite heavily to be moving around more like that in terms of their health and well-being, like is pretty amazing as in itself, which is a really good outcome.
Well, the first day we went, we had three staff and 3 residents, and one of them was 90, and they got on the play equipment down at Port Sorell, and they were going down the slide, and their comment was, whoever thought we could do this at our age? So it's that kind of story that comes out. Now we've got a busload going.
They might be able to get Louise to do a longitudinal study on the impact of the residents living to well in their hundreds.
I reckon that's just a fantastic story, and champions of health and wellbeing and examples that you've been able to give are really great. Can you just tell us a little bit about the impact it's had on your families? We heard a little bit about the toast and the Pop-Tarts in one family, but also the connections back into your community. Have you been able to inspire others in your community by your example?
Well, yes, because we've had the challenges with the primary school, with the high school. They now come in and help with activities in the aged care facility as well. I think we look at our staff member holistically, as in their family, what their needs are, what their family's needs are. Do we need to change a shift so they can get to the sports carnival tomorrow, which impacts everybody else, and the families are getting involved in our activities, and yeah, I think it's quite big.
I'll just mirror what everyone else has said. Well done, it's fabulous. You started off and said that you had no budget, and I'm wondering 12 months down the track, has management been able to see the value of what you've been doing? Have they contributed some money towards it, and has that made a difference or not?
We've got 6 hours per fortnight, which
Started out, I just fitted it into my job, and these 2 volunteered, really. Now, Alora's allowed time in her normal day that we cover her shift. Carol's got extra time. We're paying other people to come in, and they're kind of matching some of our costs with different things that we have. So they're definitely coming on board, and it's making it a lot easier to provide more services to more staff.
Yeah, well done. I noticed the little bit just about Marco, the sight dog. So is that something that you've just added into the program, or you actually think is a valuable part of your program?
No, he came to us, and so we've added him into the program.
Was he a lost dog?
I think he helps us though, he motivates us.
Yeah, he motivates, and he boosts our morale, he boosts the residents' morale. It's just, yeah, it's awesome.
And probably one more question, was it? Oh, here. All the way from South Australia, this question.
I was really interested in your goals that you set at the start of the program, and one of those was around staff turnover. Was that a big problem beforehand, and has it changed? Have you noticed any change?
It was never a huge problem. I don't know, Marie would probably be better to answer that one.
I think we're starting to see an improvement there, but it's actually about retaining our staff. Like, we've got great staff, we want to keep them. So they don't get paid very much to work in aged care, so they're dedicated anyway. So we just want to value them and keep them there. That's the main priority, really. And I think as far as I think we have influenced the community a bit, because we have had stories in the newspaper. I just think answering your question over there a little bit more is that, and I think people are saying, hey, it's really great to see you guys out there, and I think it's promoting aged care in a really positive way, and that people might get older but they've still got interests and they still want to get out there and they still want to be part of their community. So that's what we're trying to do.
As I said before, examples in practice are the best way for us all to learn. And there's an initiative of the Premier's Physical Activity Council where we're trying to gather 1,000 stories on our website, and then to have that resource available, not just for workplaces but for Tasmanians generally, about inspiring stories. So we'd certainly encourage you, if you haven't already gone online and registered your story, to do that. And we'd certainly invite every other workplace or individuals in your workplace, if they have a great story about how health and wellbeing has enabled them to turn their lives around and make a big difference. We'd love to hear about it so that we can put these together and we can follow the example that Cam's doing with his championings program to really get those messages out, because nothing resonates more than all of us. I'd suggest at the end of the day, probably what we'll remember most is that presentation that we just had.